Hi, you are watching COVID updates on Voice of Canada, and this is Sana Haroon. Fake COVID-19 vaccine passports are being sold online in a fast-growing scam that has alarmed authorities as countries bat on the documents to revive travel cybersecurity, experts says.
In Ontario, proof of getting inoculated is handed to you in a paper like this or via email. But with no security features like a QR code or a serial number, many wonder how easy it can be to reproduce the document. There are multiple reports of fake vaccine cards or passports being sold internationally on the dark web. On Amazon.ca, you can get this pack of 10 blank CDC cards for just $18.98. Criminal defense lawyer Soo Jung Lee says recreating or altering a legitimate document is a federal crime.
The most applicable offenses for these types of actions would probably be forgery. And of course, there's a separate offense for just the use or possession and trafficking of a forged document.
Canada Border Services Agency says it's aware travelers may attempt to use fake documents to enter the country. Between July 5th and July 18th, 237 travelers arriving by air and 354 arriving by land had, quote, issues related to their proof of vaccinations. In an email to Global, CBSA says, quote, Border Service officers are trained in examination techniques and use indicators, intelligence, and other information to determine a person's admissibility to Canada.
I think there's a good reason to be worried, but I'm not at all surprised. Of course there's going to be that.
University of Guelph's Karen Wendling says due to the deadly nature of COVID-19, vaccine passports should be required, especially in high-risk congregate settings. But Ryerson University's Nancy Walton says it's an ethical dilemma and the same rules may not apply in every scenario.
I think there are some other contextual pieces that are important to consider. One is vaccine equity, and of course that, requiring vaccination as part of travel then further restricts people who may already be disadvantaged.
Either way, both agree the government has to come up with some kind of process to authenticate vaccine cards, and fast.
One of the silver linings of the COVID-19 pandemic for some Canadians was the amount of money they saved. But now that restrictions are lifting, experts say they are seeing a rise in YOLO spending, inspired by the philosophy, you only live once.
The sound of cash registers opening, background noise at malls, and physically touching and feeling our purchases hasn't been a luxury for many Canadians during the pandemic.
There's a little bit of a rush you get from buying something new and having something new.
And that's why consumer researcher June Cott says we're seeing a rise in YOLO spending. Inspired by the philosophy, you only live once. People have been deprived from spending on in-person shopping and experiences, and now they're really excited to spend.
A lot of it, I think, is this restoring a sense of self-control. But we can choose what we wear, or we can choose to have a really nice meal.
YOLO spending is being noticed across the country. According to a behavioral science study released last month by Interact, Canadians have started spending more on non-essential items.
The tendency is to splurge and spend that. So take that second thought, think about where that money should go.
Money expert Melissa Leong agrees.
Make sure that some of your long-term goals are a part of this short-term burst of excitement.
Leong recommends writing down your long-term financial goals.
You want to save for retirement, you want to build up an emergency fund, you want to save for your kids' education, you want to travel.
She recommends thinking ahead about how your finances will change post-pandemic.
Inflow and the outflow of your money and how that's going to change.
Leong suggests writing down what's important to you.
Or spending in a way that's in line with your values.
She recommends prioritizing debts and separating your savings account from your checking to help curb your spending. She says act on your goals right away instead of waiting till after you've splurged and we've returned to normal. Both Leong and Cott agree on rewarding ourselves for surviving the pandemic, but to do it mindfully. They say it's easy to get caught in the you only live once mindset, but remind yourself of the life you'll be responsible for as we return to normal.
Although the COVID-19 pandemic uprooted many lives of Canadians, a new study from United Kingdom has found the coronavirus has disproportionately affected those who have intellectual disabilities.
Corey Earle has an intellectual disability and says the pandemic stripped him of his routine, his social circle, and his support.
Disabilities have been looked over beyond this pandemic. We certainly have been left behind.
The results of a large-scale study out of the UK last week show Earle may be right. It found adults living with intellectual disabilities face an increased risk of hospitalization or death due to COVID-19, 3 times that of the general population. People with Down syndrome or cerebral palsy were most in jeopardy because of pre-existing conditions including obesity, diabetes, epilepsy, and even poverty. Laura Lachance's 28-year-old son Kevin has Down syndrome.
There was a challenge to get him to increase his social distancing and to be very careful about hand sanitizing and to wear a mask in public places.
Lachance says since she was able to care for him at home, he wasn't isolated and was given an education on vaccination. But across the country, COVID-19 shot prioritization differs from province to province.
They may have been prioritized, but absolutely people are going to need help in getting access to it, whether that's online, whether that's physically getting there, etc.
Bioethicist Carrie Bowman says the pandemic has highlighted the marginalization of our community's most vulnerable and wants to see the government
develop systems of access to support, safety, as well as potentially vaccines.
People were not treated well at all in many, many cases during this pandemic. And they weren't prioritized for personal protective equipment. Their workers weren't prioritized. There were all kinds of issues for people with disabilities across the country.
New cases of COVID-19 in the United States reportedly rose in all 50 states over the past week, and doctors are blaming the surge on the highly transmissible Delta variant.
Across the U.S., COVID-19 vaccination rates have hit their lowest level since late January. 30 states have yet to vaccinate at least half their residents, even as figures now show 99% of all COVID hospitalizations and deaths are among the unvaccinated.
The tragedy is everyone who's in a hospital right now from COVID was there by choice.
Doctors are pleading with Americans to get the shot to bring this 4th surge of the pandemic under control. But even some who have gotten sick and hospitalized still doubt they'll get vaccinated.
I had not received it. In retrospect, I honestly don't know if it would have made a difference.
Los Angeles and San Diego counties are now reporting their highest number of new cases since February. On Monday, St. Louis will again mandate masks indoors. Missouri's Republican Attorney General plans to sue the city and county, even as cases in that state have shot up 70% in 2 weeks.
The UK variant was the most contagious virus we had ever seen. It took over the entire state in 3 months. The Delta variant did that in 3 weeks.
San Francisco's Bar Alliance is expected to announce Monday bars will start requiring proof of vaccination from customers. Doctors are getting increasingly concerned about what will happen in the colder months ahead, as one model predicts a tripling of the current death toll by mid-October. In Florida, where cases are also skyrocketing,
just wanted to get the word out.
Police officers in St. Petersburg are going door to door, encouraging the unvaccinated to get immunized, as Governor Ron DeSantis joins a growing list of Republicans now pushing the reluctant to get protected.
Quebec travelers can get a 3rd shot of the COVID-19 vaccine if they are traveling to a destination that requires it, the provincial government says.
But my vaccines are as good as anybody else scientifically.
Back when some Montrealers were refusing to take the AstraZeneca vaccine, Alain Dubois stepped up.
I felt relieved, I felt satisfied that I had, gotten it.
That relief has turned into frustration. Dubois wants to travel in the not-so-distant future, but because he's had 1 dose of the made-in-India Covishield shot and 1 dose of AstraZeneca, some countries don't recognize him as being fully vaccinated.
And now that I want to start traveling again, I find out that right now, politically speaking, we're being barred from Europe and the States.
Some people mixed and matched, receiving 1 AstraZeneca and 1 mRNA vaccine, either Pfizer or Moderna. Those Quebecers are now allowed to receive what the province is calling an additional dose of Pfizer or Moderna so that foreign countries consider them fully vaccinated.
I think it caught everybody by surprise.
Virologist Benoit Barbeau describes Quebec's new policy as peculiar. He says the 3rd dose won't increase immunity, only travel eligibility.
Using these doses for that purpose is definitely not something which is correct.
The health ministry warns that the third dose could have undesirable side effects, that people should get all necessary information before another injection.
We definitely have to advise clients. Every booking is a major research project.
Barbeau wonders about the morality of giving third doses just for travel when some countries still haven't had any. He says, why not ship our extras elsewhere?
And that's the message that I think is the right one, not starting to be caught up in that problem where one country prefers that vaccine brand versus that other country.
The health ministry did not address that concern when asked by Global News. Dubois hopes the government can negotiate with other countries to convince them his 2 shots are as good as any others.
Despite COVID-19 cases declining across Canada, largely due to the vaccine rollout, the inoculation rate is already plateauing in parts of the country as nearly 20% of the population remains unprotected.
Once considered one of Ontario's COVID-19 hotspots, Scarborough celebrates a milestone. Its 500,000th vaccine has been delivered.
The numbers have gone down significantly, and the patients that do come in are much less sick.
This emergency physician has not seen a COVID-positive case in weeks and credits a ramped-up vaccination effort, but he warns.
We've seen it in India, Europe, and even in the US right now. As the masking rules have started to relax, the Delta variant is a much more contagious virus.
The concern twofold for unvaccinated adults and children who aren't yet eligible to get the shot. Dr. Steve Flindahl has seen both in his ER.
2 children of the same family came in. One was old enough to have been vaccinated, but didn't. The whole family had COVID previously, and so they thought they didn't need to be vaccinated. And from what I can tell, they knew that the recommendation was that they should.
In Quebec, where the number of new cases rose by 75 Monday, a weekly vaccine lottery has begun to encourage more people to get immunized.
I saw a 19-year-old last night as I was working overnight who came in with fever, cough, and chills. Was he vaccinated even though he could have been? No, not even a first dose. Why? Didn't feel he needed it, didn't get around to it.
An easing of restrictions in Alberta, combined with a slowdown in the vaccination rate, is taking a toll.
For example, on Friday, the numbers were 173 compared to 51 the week before, and that's an immense jump.
Manitoba may have its lowest daily COVID case count since September.
We're all going to see a rise over the next 6 weeks or so, and then I think the numbers will go up rapidly once we get to the school opening.
Thousands of Australians participated in anti-lockdown protests in Sydney on Saturday, defying public health orders amidst a growing COVID-19 outbreak.
I'm hoping that we have people before the court, and I really hope we can get some charges and convictions out of today's work by the New South Wales Police. It's essential for people to get the message, and those that are calling for it to occur again next week, look out, because these 400 officers will turn into 4,000 if needs be.
To anyone who feels like what's happening with the COVID restrictions is just completely removed from reality and removed from being in touch with what's on the ground, please know you're not alone. There's a lot of people who agree with you.
Hundreds of people protested in Paris on Saturday against the introduction of health pass for some activities and against compulsory vaccinations for health workers as the government seeks to curb a 4th wave of COVID-19 infections in France.
Il a aussi beaucoup travaillé sur les questions d'énergie et sur les questions d'écologie. Il s'agit, c'est absolument irrationnel.
Macron, démission! Démission! Macron, démission!
votre division ou Jean-Frédéric Poisson. Voilà pourquoi. Est-ce que c'est ça que vous voulez? Est-ce que c'est ça que vous voulez? Non, non, nous, gendarmes, policiers, nous voici ce jour devant un choix éthique. Un choix éthique. Mes amis, le choix n'est pas facile. Amis résistants, bonjour. Quand ce 12 juillet, jour funeste, j'ai entendu que notre hymne national, pour être tous unis, pour chanter, de s'exprimer. Seuls des tyrans peuvent empêcher de faire s'exprimer des grands professeurs de médecine, comme le professeur Perron.
Keep watching COVID updates. For further details, visit our website voiceofcanada.tv.